The final step in evaluation of the supraspinatus tendon is evaluation for subacromial impingement. There's two maneuvers that we're going to use for looking for the slide of the supraspinatus tendon underneath the acromion. The first one is we ask the patient to turn their thumb in, use about 30 degrees of abduction, and ask them to extend their arm out while we have the transducer along the long axis of the acromion and the supraspinatus tendon. The second maneuver, we ask the patient to bend their arm 90 degrees, once again placing the transducer over the acromion and the supraspinatus tendon, and just ask them to abduct the arm back and forth. So we'll do both of those tests under ultrasound evaluation. With the transducer placed in a long axis of the supraspinatus tendon and using the acromion, I want to point out the critical landmarks before we do the dynamic maneuver. First of all, we have the acromion process. Then we have the humeral head, the footprint of the greater tuberosity, the supraspinatus tendon, the area of the subacromial cell deltoid bursa, and the deltoid muscle. Normally, what should happen when the patient elevates their arm, the bursa and the tendon should slide underneath. Tendon comes back out. Once again, you can see the whole process moves in synchronous movement. Now, once we have accomplished that, we ask the patient to bend their arm 90 degrees, reacquire our landmarks, and ask them to bring the arm out, tendon slides underneath, and bring it back down, the tendon comes back into view. Depending on the institution, you can do one or both of these types of tests for subacromial impingement.